everybody's losing interest.
I
Maybe
think
even you guys.
it's because winter came back and everybody said, oh, we don't want to do that.
I know, I definitely, I feel that any pain there. But.
We come back because we want to see what kind of basketball move we have.
Oh.
I found out if I go slower, I don't get hurt.
So it's the arm, and then the eye, and then I noticed the nose.
That was a skin cancer cut off, but I did play
And
on Monday.
I didn't hurt myself, so. All right, so to start tonight, I've asked a friend to share some of her experiences with one of our topics tonight, as well as some nutrition information that she has found successful. So her name is Mona Stouffer. Mona, if you want to come on up, and I'll give you the floor to start here. I want to set some of this down.
I will. Put it on that stool. Thanks. Okay. And I even have a timer, so I won't take up much of your time. Good evening. And my name's Mona, and I am a dental hygienist by trade. I've been in dentistry for about 40 years. And I'm also a breast cancer survivor. I just finished chemo in October. I had invasive ductal carcinoma. And while I was sick, my coach, that was my personal trainer, introduced me to isogenics. And that nutrition did give me the type of nutrients that I needed to fight for my life. Before I go on, I want you to know that I have been on bioidentical hormones since 2005. I started out with Dr. Pakovich, and my breast cancer had nothing to do with hormones. Nothing. There's 3 transmitters: estrogen, progesterone, and HER2. I was HER2 positive. In fact, my oncologist didn't take me off of my bioidenticals, and her words were, I don't want to open up another can of worms. So a piece of the puzzle is balancing out those hormones. And another piece is, of course, moving. But if you put the right nutrition in your body, you want to move. You're able to move. One thing is the shakes are plant-based. They only have 1 gram of sugar derived from honey and molasses. When you put sugar in your body, you're feeding cancer. You're feeding inflammation. So I have to go back to my dental roots. If your mouth is not healthy, you are causing inflammation. You can cause a heart attack, a stroke. Raise your A1C if you're a diabetic. I always said that bioidentical hormones gave me back my life. And I'm telling you, this nutrition saved my life. It was easy for my family to fix me a shake. It was hard to have an appetite, but I could get a shake down. I'm just really kind of promoting the everyday health pack, because 1 shake a day and a little bit of ionics, which is sort of like a tonic. This is mixed with water, or you can get it already mixed up. It's botanicals and herbs that are extracted. Kind of gives you a little bit of a pep in your step, and it helps with stresses. Now, this is called Adaptogen Elixir, and it is also, well, it's this, but it's on steroids. It's a very concentrated form, and it does help to decrease that fight and flight. It helps to kind of give you a little bit of energy. It helps level out your blood sugar, and it also can prevent, I'm going to say, aids in helping to prevent cancer, because it does decrease inflammation. Inflammation is an awful thing for us to have in our body, and when we have sugars involved, it's like shards of glass going through our veins. And if you stop sugar cold turkey right now, it would take about 3 months for your veins to actually heal. But I'm going to be around afterwards if you have questions. I do have a card. I have some samples if you would like. It's up to you. I don't know how much time I've taken. That's really about all I have to say. Yes?
Is it for weight loss too?
Yes, it is. It's for weight gain, healthy weight loss, and it's just it's more for I have a lot of friends that are on it that are athletes and so forth. They don't want to lose weight, but it's just putting the proper nutrition in your body without putting a lot of sugar in your body. Okay?
Glad you can be around because I'm sure there'll be questions.
Yeah, I'm staying.
Okay.
Yeah,
Good.
I can't wait to hear.
All right. First time I've worn a tie in about 3 years. But this shirt and these pants deserved a tie today, and I had the perfect tie, so. All right. So I found an article, well, actually today on the radio, my mom said, you need to talk about arthritis pain and how to deal with it. She's got all this arthritis pain. So I said, okay, Mom, this one's for you. So one of her specific questions was MSG, monosodium glutamate. How bad is that, and what do I do to manage my arthritis pain better? So first thing I did was probably like you would have done. I just Googled monosodium glutamate and arthritis. And I came up with most of what I read said, yeah, that's overrated. It's really not that bad for you. Don't worry about it. That's kind of old information. If there's something on Wikipedia, that's usually unbiased, pretty objective information. And it didn't really say much about how good it was or if it was bad. So the point is don't get your information from Google. You'll get confused. If you want to go to a good place where you can get some science, it's pubmed.gov. So this is what I did, and I just typed in monosodium glutamate and arthritis, and I started looking at research articles. And so I found one. I thought, this is pretty interesting, and this is what I shared with the people on the radio. So that's the first article I found, and then I wanted to highlight this sentence right here in the article because this is kind of what I was looking for. Several studies revealed that. Right here. Physiological complications associated with MSG toxicity are hypertension, obesity, GI tract troubles, and impairment of brain function, nervous system, reproductive, and endocrine system. Someplace in there it also talked about arthritis. So now this is the abstract of the paper. So the abstract of the paper is going to go back and they're going to make statements that is commonly accepted in medical literature. So they didn't put references for these conditions because this is pretty well established. When you go to PubMed and you're reading a scientific journal or an abstract, you have to be careful that you don't just say, oh, there it is, I told you. Beets cure erectile dysfunction. Well, maybe if one article says that, it doesn't mean a lot of them say that, right? So you're looking for trends. But this kind of a statement here convinced me or made me feel pretty confident that this is pretty well established in the research. So avoid Google and go to PubMed, all right? Any questions on that? That was just something that was just current with me today. Yes, sir.
You don't really see too many Chinese guys that are overweight and have arthritis.
I don't know if they have arthritis, but you're right. You don't see them overweight.
MSG.
Right. And yes. And if you're not overweight, you probably don't have a lot of baseline inflammation as well, right? So I think that's probably a good point. Okay. So let me move on to this week's topics. We talked about preventing cancer and heart disease, and I'm not going to repeat all of those. I'm just going to show you a couple of key slides. The primary risk factors for heart disease are these 5. You come in with chest pain, these are the first questions I have. How worried do I have to be? You got the first one there, family history that's strong before the age of 65. I really have to be careful that I don't send you home at risk for a heart attack. And the more of these conditions I can check that you have, the more worried I am and the more reassured I need to be by a stress test or some other studies. Secondary risk factors are not as important, but they kind of go together with the picture of are you at risk. So we've talked about C-reactive protein, we've talked about how you reduce inflammation, And Mona is right. These are some of the ways you do it. A plant-based diet, weight loss, quality antioxidants. So this is kind of what she's talking about. Sleep apnea, if you have sleep apnea, that can increase your risk for heart disease. We know that it raises blood pressure and it lowers nitric oxide. Those are all bad things for the heart. Elevated homocysteine level, that injures the lining of the blood vessel. I talked to you about that, how I have this minor defect in that enzyme that's corrected with B complex. Obesity lowers nitric oxide, general inflammation. And then type A personality, inactivity, and Mona said it earlier, I'm glad that was perfect, Mona. Dental disease, bacteria seeding, and inflammation. So we know that's pretty well documented as well. So those are secondary risk factors, not primary, but it's part of the assessment. And if you look at this, most of these risk factors you can do something about. In fact, all of these risk factors you can do something about except the first one. So we have the #1 killer in America with almost every one of the primary and secondary risk factors within our power to do something about it, to reduce the risk. Shouldn't be the #1 killer. Okay. And then we talked about preventing cancer. I just listed a few of these. And then breast cancer is, again, very timely with Mona's comments. Things that reduce your risk. Things that increase your risk. Synthetic hormones, unnatural hormones, chemicals that look like your hormones but aren't the same, especially Provera, which is synthetic progesterone. Really bad, should not be in your body. And then we have the rest of this list. Things that reduce your risk for breast cancer. You avoid everything on the left column, and then all these. And she's definitely right, and we talked about this. You don't want to feed cancer with sugar. All right, and then we talked a little bit about visceral fat and cancer. Visceral fat, the bigger your belly, the more inflammation you have, and the more of association you have with breast, prostate, uterine, and colon cancer. A big belly increases bad estrogen. The bad estrogen is called estrone, S-T-R-O-N-E. It's E1 is the abbreviation. And we know that lowers nitric oxide levels. And we know visceral fat increases all the markers of inflammation we measure in the blood. So as you reduce that, you reduce your inflammatory state. This was the list of screening tests that we recommend. You note all these are screening for cancer, and the goal here is to pick it up early without likely to cause harm or further testing that's unnecessary. So these recommendations are just vigorously and rigorously reviewed by panels of experts every couple of years, and they look at a lot of studies to make sure that these are the best way to screen, because the last thing we want to do is screen for something too late, or screen for something that we can't do anything about, or screen for something we may cause more problems with. So for prostate cancer, they said we no longer recommend you do the PSA. The reason is we get an elevated PSA on a guy and do a prostate biopsy, 6 or 12 sticks in the prostate through the rectum. Painful, can cause infections, and can cause bleeding. Just had a friend just had one done last week, and it's now a week later he's finally comfortable. But what was happening is we're causing more good than we were, or more bad than harm. And how likely is it that a small needle is going to get that prostate cancer? You got 12 zones, and what if you go right past it and miss it? So they said don't do that anymore. Do the digital rectal exam every year. I still think that PSA is a much better test, because it's hard to feel a prostate cancer when your short finger is only wiggling that much and the prostate's this big around, and you can only reach a very small percentage of the surface area. So the PSA is something I still do. All right, and we talked about immunizations, and I'm not going to go over that because it's already been covered. What I wanted to spend most of my time on is something that I feel pretty confident talking about, and this is something you all need to know about and at least be aware of. So when you think about aging and what makes you feel older, and there are days days we all feel older. I felt pretty old on Saturday. I don't know if some of you did, but with the barometric pressure changes and the temperature, my gosh, I was hurting and sluggish, and even yesterday I felt it. So we're still going through that with the temperature changes. But that's kind of a combination of this list as well. So when we feel old, these are the reasons why we start to age and feel that way. So we want to make sure that we do all we can to slow the aging process, to slow the shortening of those telomeres. So these are the things that we're going to talk about specifically. Cortisol, we're going to talk about thyroid, and we're going to talk about these steroid hormones. Now, this next slide fits into something Mona said. So she said a lot that was a perfect dovetail to tonight's lecture. Thank you, Mona, for that. So I wanted to talk to you about adrenal fatigue, because you may have heard of this. And this is common, and actually that little bottle that she had is for fighting adrenal fatigue. So I have some of that I've been taking. Because let me explain to you what adrenal fatigue is. So cortisol is the key hormone here. Cortisol is how we fight adrenal fatigue. So when you're under stress, an acute stressful situation, and I always use this analogy just because it helps to set the stage. I don't even know if it's accurate. I don't even know if my brother could probably tell me. I guess there's probably no more soldiers in Afghanistan, theoretically. But we do have soldiers, Marines, and units in the Middle East, and they're still, I'm assuming they're still battling, terrorist organizations. So let's say you're in a SEAL team and you get dropped off into enemy territory, and for the next 60 days, you're on high alert because you don't know if the enemy is that little boy in the street or if there's somebody in a window behind you going to shoot you from the back. I mean, you're stressed all the time. What does your body do? It says, we'll help you. We're going to make your adrenal glands squirt out cortisol. When cortisol levels go up, as in acute stress, it decreases pain. It decreases inflammation. This is perfect. You've twisted your ankle in combat. You just fell and twisted your ankle. You have less pain and less inflammation. That's a survival mechanism that cortisol provides. The other thing that it does that it's maybe not the best thing is that it increases belly fat. And we know visceral fat's inflammatory, but visceral fat is a great place to store energy for when you're going to need it later, because you might not be eating for 3 or 4 days and you got to burn fat. So it will store visceral fat. That's the short term. That's what cortisol does in the short term. These are all positives. But let's say that 30 days in combat now is stretched into, you're in your 7th or 8th week, and your adrenal glands say, I can't keep this up. I can't keep making all this cortisol because of the stress you have. Now, probably none of us are going to have that kind of stress, but a lot of us have enough emotional stress every day, sleep deprivation, aging parents, we have children and grandchildren, health conditions and concerns, that a lot of us are in this chronic stress. And when the stress becomes chronic, these are some of the things that happen. Hopefully everybody can see this. So now your adrenal glands say, I can't keep doing this. I can't keep making cortisol. So when that happens, the opposite effect happens. You have more pain, more inflammation, and you still have belly fat. So long-term, stress will cause you to gain weight. Short-term, it doesn't, but long-term, it will. And the classic symptom of somebody with adrenal fatigue is wired at night, tired in the morning. They just can't shut their mind down at night, and then they can't get up and get going in the morning. They're exhausted. So here's what the body does to try to help you, because this hormone is more important than any other hormone. Now, this is a pretty complicated chart. This is the steroid pathway. Okay, so right on top is cholesterol. That's the first molecule. Next, we have progesterone. Women, this is what keeps you pregnant when you get pregnant. This is what fixes your PMS and treats your postpartum depression. So that's a really important hormone. Then we have testosterone. Then we have estrogen or estradiol, and men and women have both of these. There's no purpose for progesterone in men, so men shouldn't take progesterone, but these are important in men and women both. So the body says, okay, you can't make cortisol anymore. Let's shuttle some progesterone over here to help you make cortisol, because you can see it just goes right down through this pathway to make cortisol. So what happens then if you're somebody who's had some PMS, but it hasn't been bad for a while, and now all of a sudden you have 12 weeks of chronic stress, and you take the little progesterone that you have and you make cortisol out of it, how do you think your PMS is going to be? It's going to be worse, right? Because progesterone is what's keeping you from going into PMS. So now all of a sudden your PMS is really bad. And some of you women know that sometimes it's really bad, others it's not as bad. This is the reason why. If you have a soldier that comes back from combat with the stress I'm talking about, with low testosterone levels, they'll come back from a 6 or 12-month deployment, and a lot of them will be like, yeah, I haven't seen my wife in a long time, but my sex drive is really low. And all those weights that I used to lift when I first got deployed, I don't really feel like doing that anymore, because they're taking their testosterone and converting it to cortisol, because that's the stress hormone that helps them stay alive in that chronic stressful situation. What about estrogen? Some of you women who have been through menopause and thought, my hot flashes were 15 years ago, I thought it was done, all of a sudden I started having hot flashes again. Like, where did that come from? Well, that comes from this pathway, because if you're taking the small amount of estrogen that you have and you're using it to make cortisol, that small amount of estrogen was keeping you from having hot flashes, night sweats, vaginal dryness, and bladder issues. And now you're starting to have them again. You're thinking, well, it should have been past that time. So all of these, when these get shuttled, you can sense there's a change, and you're wondering why all of a sudden this changed. But there's a hormone, a steroid hormone, that the body says, you know what, if you use me, we won't have to use these hormones that you're going to maybe not feel as good with. And that hormone that is preferentially used is dehydroepiandrosterone, or DHEA, which we talked about. That's a supplement you get at the health food stores and the pharmacies. So the body says, let's use this, because you're not going to miss the effects of me as you would these. So when I have patients in the hospital, and these are usually elderly people with a lot of chronic illnesses, and I check this level in them, what kind of a number do you think they have? High or low? It's really low, right? And I just saw somebody today in her, I think it was mid-40s, and she's feeling pretty good, but she said, I've got a lot of stress. I'm doing all this stuff, and I've always done this. And I said, I bet you're low, and her DHEA level was low. So how do you fix adrenal fatigue? How do you fix this problem? What's that? That's it. That was great, because you could have said, take DHEA. That's the second. Lower the stress, right? You have to fix the root cause. And stress is something that we often create for ourselves. It's a story we write about situations that probably won't happen, but we project and we worry and we can't sleep. You think about your kids and grandkids, they're doing this, and then they're going to do this, they're going to end up in jail. And like, you're 10 years ahead of yourself on that, right? So don't stress about those things. When you have a stressful day, your body, nature would say, oh, it was a stressful day today. Tomorrow, guess what? You stay home from work, you take a bubble bath, you read a good book, and you go to a funny movie. That's how we're supposed to do it, but we don't do that. So then there's the role for DHEA to help with that, and adrenal adaptogens, which is what Mona was talking about. So these adrenal adaptogens have cortisol and cortisone-like support molecules in them to help you recover. And I've seen them work for me. I've taken it one other time at a really stressful time, and to me it felt like it worked. One other thing here that you should know about is this molecule here. Here's cortisol and here's cortisone. And there's a cousin to cortisone that you've all heard of, prednisone. Prednisone is almost the same molecule. So if you're having adrenal fatigue, have any of you taken prednisone? How do you feel when you take it? You feel crazy? I mean, usually it gives you a boost of energy, right? You don't hurt as much and you have more energy. That's perfect short term, but you don't want to take it long term, because then it does this and it does these things long term. So you don't want to take it long term. But that's also kind of on that pathway. So any questions on adrenal fatigue? Yes?
Does prednisone and short term means weeks or months?
Yeah, I would say a week or two. I wouldn't do it long term. I do have a patient who she's just got so much pain, and that's all she wants to tell me about when she comes in. It's all she talks about. So, you know, she's kind of feeding this pain by all of her thoughts and everything, but I get it. And she came in Monday, and I said, I already know what you're going to tell me. Because it's the barometric pressures have changed, and I'm feeling some of this discomfort, and the only thing I know to tell you to do is to take some prednisone. She can't take some pain medicines because of her blood thinners. I said, take some prednisone. So she was happy. You know why? She knew prednisone was going to work, and she knew I was listening to her, and I was empathizing. But I said, you really don't want to take this long term. You save this for those days you're really hurting. Okay, so it can be powerful, but you don't want to take it long term. It accelerates the development of cataracts. It suppresses your immune system. It makes your bones weaker, and it causes you to gain weight. So it's not, unfortunately, it's not a good long-term solution. Your answer was perfect. Deal with your stress better, right? That means we're all a little dysfunctional and we need counseling.
That's easier said than done.
I know.
Because I always thought I was cool, calm, and collected, but till I got daughter-in-laws. I had sons,
Yeah,
and they say, now, you're really stressed.
Yeah.
Please, just, you think too much, just
yeah,
go with the flow, I thought.
yeah, yeah. I know. We learn a lot about ourselves as time goes on. Yes, yes, sir.
What about cortisone shots for like athletes?
Yes, so cortisone shots are very helpful for the knees and shoulders, and they usually decrease the pain sometimes for 3 or 4 months. Makes you feel a lot better and function better. But just remember, every time you stick a needle into a joint and through a membrane, there's a risk for infection, and you're always tearing something when that needle goes in, so there's a little scar tissue. And the steroids themselves break down some of the healthy tissues. So if I just wouldn't want to get too many shots in the same area. I'd want to fix the root cause, fix the mechanical issue. And you'd be amazed that we've talked about this. If you fix the mechanical problem of a joint, you can feel much better. You know, today I went to the massage therapist and I told her, Dr. J embarrassed me in front of my Fit for Life class and told my class I have poor posture. So I need you to fix it today. So guess what I told her to work on? I said, stretch my chest muscles out because they tend to pull in like that. And then he says, I got big traps only because I have poor posture. So I'm working on that. And that helps to keep my shoulders healthy and helps to keep my neck more straight and not frozen in a forward position. Okay, so these are the steroid hormones that decline with age, and this is just this isn't a scientific picture. It's just an illustration of the fact that our hormone levels, these good hormones, peak in our 20s, and then they slowly start to drop off, and it probably starts to drop faster than it should when we're in our 40s and 50s, and it's because of all the environmental exposures that I'll show you in a minute. But, you know, a teenager has pretty high testosterone levels and hormone levels, but then they really peak in the 20s. So this is the peak reproductive decade. This is the peak athletic performance decade. And as things slowly decline, our functional abilities in a lot of ways start to decline. But this rapid decline is not what it should be. It should be a much slower decline. So I want to show you in a couple slides why that is. Okay, so why are we having problems with our hormones? Why is there such a rapid decline here when it should be a much slower decline? Well, here's some of the reasons, and this looks like, oh, you just pulled this out of the air. No, this is like having attended probably a couple dozen conferences where I've heard speakers and experts in different fields tell me the same kind of thing. So this is the summary of what all those conferences talked about. Probably the biggest one is all these environmental exposures, these new chemicals that have entered our society in the last 100 years. These are called endocrine disruptors, and they will affect our hormone levels. Then we have probably one of the biggest offenders are the pesticides that are sprayed on our foods. These get sprayed on a field, and they don't come off when it rains. If they came off when it rained, it wouldn't have its effect. So when you wash a tomato or broccoli under the faucet, Do you think you're getting the pesticides off? You're not. They don't come off easily. That water ionizer that I showed you, if you go to that website that I recommended, that does take a lot of those pesticides off. So that's the only way I know that you can do that. But these definitely are an offender. And then we've got the pollution in the air and in the water supplies and in plastic products everywhere. Plastic have endocrine disruptors, the BPA and BPSs. And then finally, the last offender is processed foods. So these are probably the 5 or 6 primary reasons why we have hormonal imbalances. And many of you don't realize you have it. You're just thinking, well, I'm older now. This is kind of how I feel. And I'm out of shape. I haven't exercised in a while. What do you expect? All right, so this is some pretty interesting study here. These are environmental exposures and hormones. So this study was looking at DDT levels. DDT was a pesticide used back in the 50s. And it suggested that exposure was associated with an earlier age of menarche, which is when girls start periods. I mean, I saw a girl the other day who's having periods and is well developed and she's 10 years old. But that's almost becoming the norm now than the exception. And it's because of these kind of exposures that this is happening. So earlier age of menarche and an increased risk of experiencing a shortened menstrual cycle. This is a study on parabens. Parabens are in creams, cosmetics, and they're strongly suggested to be found in the skin. So that this study was saying, yeah, it wasn't something that people ingested and swallowed. It was something that was in their skin. And what they noticed that there was a lot of these parabens that were found in the upper outer axillary, in the underarm area, and they were draining there because of cosmetics that were placed on the face or around the breast. And these were associated with breast cancer because most breast cancer is the upper outer quadrant. Okay, so this was 7 out of 4 women had these paraben residues found in their skin in those regions. And they found them in antiperspirants and deodorants and lotions and sun creams and moisturizers that were applied to the breast, chest, and upper arms. Atrazine, this one is fascinating to me. So this is one of the most widely used herbicides. It's a weed killer of choice for corn and grain and citrus fruits and sugarcane. Banned in Europe in 2003. Do you think it was banned here? No. We use 70 to 80 million pounds a year on our crops. It's the major contaminant of groundwater in the Midwest. And it can travel 600 miles from the point of application. And it's in France, at least, it was found to be in the groundwater for more than 15 years. So you spray it on a field, it doesn't go away, and it travels a long distance. And it's estimated that 60% of all Americans are exposed to this bad herbicide, endocrine disruptor, every day. Okay, now, if you want to see the everyday, this is the atrazine map. So the red is the most concentrated areas of atrazine in our country. And this is the corn belt. Remember, it's the fertilizer of choice for corn. And you look up here real close and you're like, well, that's pretty close to Tuscarawas County, but it's probably, no, we probably missed us. Well, that's an older map. So if it travels 600 miles from where it's applied, it's probably something we're exposed to. I feel really bad for farmers that don't realize they're exposed to this. I feel bad for people who spray for True Green and Kenmalon all the time because they're breathing it in as well as having skin contact. These are just, this is one of the slides I got from a presentation I was at showing the direct toxicity of glyphosate. Glyphosate is also a real commonly used fertilizer, herbicide, pesticide. It's made by Monsanto. Some of you know that name. Well, I won't say what I think about Monsanto, but you can probably imagine. But these are just showing you the references for the studies and the rate per million, parts per million, 0.5 parts per million in this study proved human cell endocrine disruption. A part per billion is a drop of water in an Olympic-sized swimming pool. This is a part per million, so it's more than that, but that's not very much. Anti-androgenic means it works against the effects of testosterone. Disrupts aromatase enzymes that converts testosterone to estrogen. And you can read down here, DNA damage, cell toxic, multiple cell damage, total cell death. I mean, all that stuff is bad. Parkinson's, all those things are bad. Right? That's the point of this. It's a little complicated, busy slide, but the point is this glyphosate alone, which is in Roundup that some of us use, is very toxic and it disrupts our hormones. This study I found pretty fascinating. This is the one that's where it's 1 part per billion is a drop of water in an Olympic-sized swimming pool. And in this study, 0.1 part per billion were found, toxic effects were found in frogs. And they said that the urine from a farmer contains on average 2,400 parts per billion. So I don't even know what that's a factor of 10,000 more concentrated in the urine of farmers than in a frog that can have chemical disruption or endocrine disruption from exposure. And the next statement is pretty mind-boggling. And this is right from this report, that he stated, Dr. Hayes stated that this kind of contamination in a farmer, 2,400 parts per billion, could chemically castrate almost 750,000 frogs, just taking the dilute urine from a farmer. Okay, so this is kind of invisible. Most people don't know about it, but it's real. And I can tell you, I've seen men come out of my office, 35-year-old men who look like alpha males, big muscular guys, and saying, I don't know what's wrong with me. I don't want to lift weights anymore. I have no energy. I have no drive. I've lost my interest in sex. Something is wrong. And when I check their testosterone levels, they're really, really low. When they go back on it, they feel like themselves again. I've even seen 22, 23-year-olds have very low levels. I think that's the exception, but I have seen it. So this glyphosate is the most used herbicide worldwide, and you can see the amount that was applied in 2011. Here's a study that talked about Roundup, that at lower non-toxic concentrations, one part per million, it's the main endocrine disruptor of testosterone, decreases by 35%. So I still have Roundup, but I'm really careful. I wear gloves, and I'm really careful. I try not to stay away from it when I could potentially breathe it, and I try to keep it off my hands. So let me just show you, when your hormones are balanced and they look really good, this is what a young person could look like. This is my nephew. So Tom, you might want to take a picture real quick here of that's his son. And Dylan's actually entering a bodybuilding contest on Saturday. But he was a skinny, wiry kid when he was 16, 17, and within 2 years of lifting weights, he turned to, he really put the muscle on really well. So that's what hormones can do for us. Not that, I'm not saying this should be anybody's goal, but this is what happens when you eat decent and you have optimal hormones and you train right, and good genetics. All right, so let's go back to something maybe all of us can relate to. These are tips for managing our hormone levels. So I'm going to talk about how hormone replacement does this, but some of you are going to be like, I don't know if I want to do that. Just tell me simple things that I can do. So here's your simple list of how you optimize your hormones. So naturally balancing your estrogen. You want to raise the good estrogen levels in menopause. And if you're not going to take estrogen to do that, you can take soy products which have estrogen-like compounds. You can try black cohosh. Some of you may have tried either one of those for your hot flashes, and sometimes it works, but it usually doesn't work great. You can also try to lower the bad estrogens. And the way you do that is by eliminating the bad estrogens. Your body is trying to do that. Your liver is trying to do that. So if you eat the cruciferous vegetables, the vegetables that stink, broccoli, Brussels sprouts, cauliflower, kale, they're high in indole 3-carbinol. They have a lot of sulfur in them, and that helps to clean your liver so you can get these bad estrogens out of your body. You can also buy indole 3-carbinol as a supplement and take it. But you also want to avoid the bad estrogens. These are the estrogens that cause a lot of you women to have fibroid tumors and a lot of bleeding, postpartum depression and PMS and early hysterectomies because of the cumulative effect of all these xenoestrogens, like a false estrogen, like a pseudoestrogen. And these are some of the places you get these. When you have a hamburger patty in a baggie and you throw that in the microwave to heat it up, the heat of the microwave will activate some of these bad estrogen-like compounds and be another exposure. So it's a lot of little things that we do without thinking about it. We already talked about cosmetics with parabens, and a lot of the cosmetics now say paraben-free, but they may not be as paraben-free as you think they are, because just like we learned with food labels, it's deceiving. And unless you really know what you're looking for, you can be fooled. So how do you balance your testosterone, keep that optimal? Well, you want to minimize your exposure to pesticides and enhance your natural testosterone. So the way you do that is you train hard and you train fast. You lift weights or you do something to strengthen your muscles, men and women both, so that you're sore for a couple days. And you got to do this safe. You don't want to hurt yourself with the wrong technique. But if you have good technique and you do enough exercises, you'll be sore in those muscles for a couple days. That means the body is saying, oh, you just really stressed me. Let me make that muscle stronger and let me make some more testosterone so I can support that type of activity in the future. Sleep is crucial. This is one we overlook. When we go in deep sleep, that's when we make testosterone. That's when we heal our body. That's when we make growth hormone. So a lot of us are sleep deprived. Some of us have sleep apnea, and we don't get into deep sleep very often, and that will disrupt your hormones. So if you have sleep apnea, make sure it's being treated appropriately, and make sure you're getting enough sleep. So what interferes with deep sleep? Well, these are some of the things that do it. So we have to address the root causes here. I've been so busy with so many things that I'm sleep deprived. So I hate to admit it, but the only way to get through the day is caffeine. So I'm using more caffeine. But I have this Fitbit that tells me each night that my sleep quality is not as good because my resting heart rate is not as low as it should be. So now I've been off of caffeine for a couple days, and I'm going to try to stay away from it because it's impairing my sleep. And I told you before, when I'm tired, my body's saying, you need more rest, not you need more caffeine. Alcohol will kill testosterone. It will kill nitric oxide, so you have to really be careful of that. This was in one of the presentations I was in. I just put this up here for men. And you women can say, well, it kills my estrogen, so there. Yes?
I'm sorry, the sleep, I also track mine on my Fitbit,
Mm-hmm.
but the deep sleep is always really low compared to the rest.
Yes.
What would you say, like percentage-wise, you should have a deep sleep?
That's a great question, and all I can tell you is what the Fitbit tells me is this is, I don't know if yours tells you the same thing, it says this is the average for someone in your age, for a man your age. It tells me if I'm kind of at the average or above or below. Everybody cycles through it differently. And one of the problems that we have with sleep is that as we get older, we have less and less time in deep sleep and more time in light sleep. So you're a lighter sleeper. You take naps in the daytime when you hit your 80s. When you're a child and you're growing, it's almost all deep sleep. And that's when they have growing pains because their bones are actually stretching. They wake up with sore legs. But deep sleep is crucial. It's just that we'll get less and less of it as we get older. And then there are some vitamins that can help replenish cortisol, and these would be in some of these adrenal adaptogens that Mona was talking about. I'd be curious to know if the one that you have, if it has zinc and vitamin C and some of those. I'm guessing it does, but that's the reason. It's all part of that pathway. Okay, the DHEA is that stress hormone that you use, and you can improve your DHEA production by managing stress. Don't burden that DHEA too much. Get good sleep, exercise, and the same vitamins and minerals that help your adrenal fatigue. Thyroid, we'll talk about that a little bit more towards the end. But the problem that most of us have is that we don't make T3. That's the active thyroid hormone that makes us feel better. And the reason we don't make it is because that we poison an enzyme that makes T3 out of T4, and these are some of the things that interfere with that enzyme. These are some of the variables that poison the enzyme so it can't do its job to make T3. So we're always going to come back to sweets and carbs, limiting our exposure to mercury, lead, and cadmium. I had a friend who was in the military, and he was tired, and I said, well, check your thyroid level. So he checked it, and it was low. His T3 was low. And he's like, yeah, I don't know why it'd be low, because I'm pretty healthy. I'm pretty young. Well, he was wearing a bullet on a necklace. That bullet was full of lead right in front of his thyroid. So he stopped wearing the necklace. Okay, so when it comes to thyroid, yes, you can supplement with selenium and zinc. But if you're looking to feel symptomatically better from your thyroid, to know that you're better with your low thyroid symptoms, that's probably not going to fix it. I'd still take selenium and zinc, but I also take thyroid. So why are we afraid of hormones? Because some of you are like, yeah, I heard they're bad. Well, there's one study that came out in 2002, published in the Journal of American Medical Association. They looked at 16,000 women who were in menopause, and they said, we're going to put you women on 3 different hormone replacements to see how well you do with your menopausal symptoms. So they used Premarin, Provera, and Prempro. Premarin is synthetic estrogen. It's not the same molecule that your body makes. Provera is synthetic progesterone. It's not the same molecule that your body makes. And Prempro is the combination of those two. It's foreign to the body. So where am I going with this? We always talk about this, right? It doesn't sound good. It doesn't sound like we should be doing this, right? Well, you're right. They stopped this study after 5 years because the observations were pretty overwhelming. That the Prempro group that had both of these synthetic hormones in, you can see the numbers. A huge increase in breast cancer, heart disease, and stroke. So I was in my office when this was reported on the evening news, and the next day, all these women were calling me, what do I do? I'm like, you got to stop that. I heard it too. And so everybody heard and thought, these hormones are bad, you can't take them, you got to stop them. So it took several years to go back and study this really thoroughly, but when they did, they found that it was the Prempro group that was causing this. It wasn't Premarin, and it wasn't Provera. This Prempro group is the one doing it. So that is still made by Wyeth Pharmaceuticals. It's still being used. But gynecologists are saying, oh, your hot flashes are bad? Okay, you can use Prempro for 6 months and then stop it. I don't know if it's going to do anything bad, but I don't. You can't take it any longer. And you're like, well, I feel great, but now I have to stop it. What am I going to do now? I don't know. But you can't take it anymore because you'll get cancer. So that's kind of the approach. So you women who are struggling with this, everybody's afraid of it. Mona's not afraid of it, but she's educated. And once you get educated, you become more confident that these hormones are good when they're optimal. So synthetic hormones, the ones that cause cancer, are molecules that are not identical, but they're inventions, essentially. They're a new molecule. So you can get a patent on something that's new, and you can make a profit on something worth a patent. And you can promote that to doctors who say, okay, let's use this because you're going to buy me lunch, and then you're going to take me to a golf outing that I don't have to pay for if I promote this. Okay, we don't do that anymore, but that used to be the way these drugs were promoted. Versus bioidentical, which is they're created from plants, sometimes in the laboratory, but the most important thing is when your body sees them, it says, where have you been? I know where you are. I was making you in my ovaries a while ago, and then you just disappeared. I'll tell you where to go and what to do. But because this isn't new, there's no patent on it, there's no profit, so there's no marketing, and And doctors aren't going to be aware of it because it's the pharmaceutical industry that really has the biggest education on allopathic physicians. So this is why structure matters so much. This is a common chemical called benzene. It's a carcinogenic, cancer-causing. If we change that slightly, this is something you probably ate today. This is benzoic acid or sodium benzoate. It's a food preservative. Probably not the best, but not near as bad as benzene. And if you change that molecule a little bit more, now you have this one called aniline, which is a poison that ignites. So which one of these do you want to put in your body? I can tell you for sure I don't want the one on either end. Maybe benzoic acid, but for sure not these other ones. So let me show you what synthetic estrogen looks like versus natural estrogen. So here's what we all make. This is good for a man's prostate and for his heart and his cholesterol. This is good for almost everything on a woman. This is what makes women look like women. It causes the breasts to develop, the curves to develop, the fat deposition that makes women look like women. It's great for the bones. It's what prevents osteoporosis, keeps the heart healthy, reduces the risk of dementia and stroke, keeps women lubricated so they don't get urinary infections. I mean, this is a wonderful, wonderful hormone. That's what it looks like. This is that same hormone that's in horses. Okay, so you see there's the difference. It's not the same. Here's another molecule that's in horse urine. So when we give you Premarin, this is what we're giving you. We're giving you this, but guess what else you get with your Premarin? You get all those other ones. So you know how I know if you're taking Premarin? When you're in a hurry, you gallop. So you don't want to gallop. Don't walk so fast. Okay, so here's all the good things that estrogen does for you. That's perfect. Wow. God was pretty good when he came up with these hormones. If you're not on estrogen and you start it later, a lot of women will say, yeah, my skin's a lot softer and smoother. This is menopause. This is what happens on menopause. Okay, so I know I showed you all this, but I'm just trying to explain it to you so that it sticks a little better. Another key point here is that you don't want to have a normal level. You want to have an optimal level. You don't want to be on the low end. You want to be on the higher end with these. Okay, so this is a normal female. This is a woman who's menstruating. So this is after she has a period, it's low, and then mid-cycle it goes up because estrogen makes you ovulate. But when you're in menopause, those levels are low. So where should a menopausal woman be with her estrogen? She should be probably in this range, high normal, because you get all these benefits. Okay, here's progesterone. The one on the left is the natural progesterone that you make, and the one on the right is in Provera. That is a bad one. With horse estrogen, and Provera causes cancer, heart disease, and strokes. All the benefits of progesterone, it's the feel-good hormone. It helps you when you're having PMS issues and you're bloated and you got this water retention, your breasts are sore, it's all from water retention. So if you make enough progesterone, you won't have those PMS issues. But if you don't make enough progesterone, how do you think I treat PMS? I give you progesterone, right? You just don't have enough. You get enough progesterone and you don't have any PMS symptoms. So those are some of the PMS symptoms that you can get rid of with progesterone. You take it for that 7 to 10 days before a cycle when you feel miserable. And you take as much as you need to have those symptoms go away. All right, these are just straight from some journals. Elevated serum progesterone concentrations associated with a statistically significant reduction in breast cancer risk. Can you see now why Mona would take progesterone? It's right there. This is in a journal of national cancer. This is a major journal. And every oncologist, every gynecologist should know this, but they don't because this goes against their training. It doesn't sound right. Here's another one. Synthetic progesterone stimulates the proliferation of breast cancer cells. That's Provera in your body. Natural progesterone, alone or with estradiol, reduces the proliferation of breast cancer cells and induces cancer cell death. If I'm a woman trying to kill cancer, I want optimal progesterone levels into menopause. Here's a pretty cool study that talked about the benefits of progesterone. You can see it right at the top there. It says progesterone and its metabolites exhibit antipsychotic properties. How does a woman with bad PMS feel? She feels a little psychotic, right? Or maybe her husband thinks she's psychotic. But with progesterone, everything calms down. And they said it has similar properties to the antipsychotic drugs. So when people in the hospital are just in the middle of the night, they're wandering around with their clothes off and wandering in somebody's room and just out of their brain, we could give them progesterone, but nobody in the hospital knows that but me. So what we do is we give them Haldol right here. It's an antipsychotic. All right, so this is a fertility study. Hormone replacement therapy in young women is safe and effective to prevent osteoporotic fractures, heart disease, diabetes, and dementia. Wouldn't you want that? That's primarily estrogen. Wouldn't you want that? Progesterone has a favorable action on the blood vessels and on the brain, whereas these synthetic ones don't. And natural progesterone confers no risk of breast cancer as opposed to synthetic ones that do. So, am I convinced you that progesterone is good? You should be convinced. This is just showing you what happens when you have a cycle. This is right after you stop bleeding, after 4 or 5 days. Everything's low, and then the body says, okay, ovary, we're going to secrete estrogen to make you ovulate. And then you ovulate, and estrogen's kind of done its job. And then the body says, oh, okay, there's the egg. She could get pregnant. If she gets pregnant, we need something so that the body doesn't attack this uncontrolled cell growth of a baby. So we need something that's pro-pregnancy. It says, don't attack these cells. This is a baby. So another way to say pro-pregnancy is progestation. So we call it progesterone. That's what progesterone means. It means I'm not going to let the immune system attack this 7-pound baby, this tumor. So if you don't make enough progesterone, you keep miscarrying. So we'll often supply that. But here's the point with PMS. When your progesterone level is supposed to be here, but it's down here, you're going to have PMS symptoms. So this is about the time of the cycle when you would take progesterone so that these are balanced and you feel good. And it's very, very simple. So testosterone, this is for men and women both. Testosterone lowers your bad cholesterol, gives you more energy, helps your bone density. These are the deficiency symptoms. Guess what happens when we have men with prostate cancer and we wipe out their testosterone? What happens to their belly? They get fat. What happens to their cholesterol? It goes up. They can't sleep. They have more pain. They have less energy. Their libido is shot. They have no stamina. They're definitely depressed, almost to the point of suicide. You have to really watch them. They're at high risk for suicide. Does that make sense that you would do that to a man? To kill their, I mean, it's the worst thing you can do to it. I mean, a man is not even a man when you wipe out his testosterone. He knows he's not a woman. He certainly doesn't feel like a man, and he feels hopeless. So in certain situations with men with prostate cancer, you can give their testosterone back and their life comes back. It's amazing. And I don't think any urologist or oncologist should do that to a man unless they've done it to themselves first to see how bad that is. And same with women. We do a hysterectomy on you at 30 and say, good luck with life. No more periods. Isn't that nice? Heck no, because all those things will happen to you. And you'll be at higher risk for heart disease and cancer and having problems with your weight and everything else. All right, so these are just some, the hormone levels. If your doctor checks them, you don't want to be in the normal range. You want to be in the high normal range. 50 to 200 is the normal range. That means we checked the first 100 men that came through Walmart, and we measured their testosterone levels. So we got 18-year-olds, we got maybe an 85, 90-year-old, and everybody in between. And the next question is, how many of those people in Walmart or any other store is really healthy, like your role model? But this is what we do. So if your level is 50, that's probably the 85-year-old. He's very low, and he's just thinking, no, I'm 85. If you're 200, you're probably the really fit 18-year-old. So you don't want to be, as a man, you don't want to be said, well, your level is 60, you're normal, you're okay. Because if we line you up, you're standing next to the 70-year-old when you're 40. You don't want to be in the low normal, you want to be high normal. So these are just some studies saying that low testosterone in older men is associated with an increased risk of death over the following 20 years, independent of all the other risk factors. So high optimal testosterone is healthy. Free testosterone concentrations are associated with a lower risk of developing Alzheimer's. Gosh, that's something people didn't realize. Prostate cancer was present in 1 out of 7 biopsies with a normal PSA, but there's an increased rate of cancer associated with lower levels of testosterone. My dad's had prostate cancer, so I'm at higher risk. And you would think, well, don't take testosterone. No, this study says take testosterone and it'll reduce your risk. And my PSA has stayed good. Adverse effects of testosterone deficiency on body composition, insulin sensitivity, and systemic inflammation. We take your testosterone away, or you have low testosterone, men and women, and you're going to have more fat, more body fat, more insulin insensitivity, meaning higher sugar, more weight gain, and more systemic inflammation. And you're going to have increased risk for heart disease. This is DHEA. These are some of the things that can do for you. But most patients that take DHEA aren't going to say, oh, this makes all the difference. They're just going to say, I don't know, maybe a little bit better. These are the, well, I don't have the doses here, but for women it's 10 to 25 milligrams a day, and for men it's 75 to 100 if you're going to supplement with it. And you get that over the counter. 10 to 25 for women. I would get it at Mako's or Dover Healthy Alternatives, so you get the best quality there. This was just showing you that low serum levels of DHEA predicts all-cause and cardiovascular mortality in the Swedish study. So the lower the levels of DHEA, the higher risk of dying. But why is the DHEA low? What did I show you at the very beginning? It's low because of stress, right? So we know that. This is like another way of saying stress kills. You're really good. You stayed right on it. All right, thyroid. This is one that maybe not everybody needs these steroids, but a lot of you probably want to optimize your thyroid. These are the deficiency symptoms. And I'll tell you the ones, especially for women. If you got 2 or 3 of these, you probably need thyroid. Brittle nails, brittle hair, dry skin, which is not up there, and more hair loss than usual. If you got 2 of those, dry skin, more hair loss than usual, you probably have low thyroid. You probably should think about supplementing a thyroid. The problem is when you ask your doctor to measure it, they always measure this, and your cells could care less what that is. It has no effect on your cells. This has a minimal effect on your cells, and when they say you're in the normal range, that means nothing. They don't understand. Your cells don't care about either of those 2 hormones. They care about T3, and we don't measure that. But T3 has 4 times more activity in your cells than the other ones do. Okay, so you don't want to be told you're in the normal level. You want to be optimal, 3.5 to 4.3. When you're a teenager and you're a young kid, your free T3 levels are probably 6 or 7, and nobody panics. All right, so this is just saying, this study shows that some evidence that zinc in combination with selenium can help with thyroid function. So there's some evidence. You can try it. Not sure it'll make a big difference, but if you're not going to supplement with or get a thyroid prescription, then you could try those supplements. I'm going to skip through this slide. It's a little complex, but in the workbook, it tells you more about this pathway and how everything's connected. So you can read about this. And you can read about these, this conversion, because I already touched on that, and how you get the active T3. Recent studies suggest that relatively low thyroid function within clinical reference range is positively associated with risk factors for heart disease. Most doctors and cardiologists think, don't take thyroid, that'll put you in atrial fibrillation. It does not cause atrial fibrillation. If you get too much, it will cause your heart rate to go up. You'll have a rapid heart rate, you'll have heart palpitations, and you'll know it's too much, and you back off. But this study says it's actually good as a preventive measure against heart disease. So I want to be optimal with my thyroid, not low normal. Here's some others. I'm not going to read these, but we're all basically saying the same thing. And then melatonin it's a neurotransmitter. It's made in your brain. And right now, as the natural light goes down, you're trying to release melatonin from your brain so that when the light is gone, natural light's gone in an hour or two, you start feeling tired. The problem is, as you get older, you don't make as much melatonin. You can see how it drops off. The other problem is you don't make it very well because sunlight stimulates melatonin synthesis in your brain, natural sunlight. And then you don't release it because you don't make it, and there you are in your bed. You're tired, you're almost asleep on the couch, and you go to your bed. By the time you're in your bed, you kind of wake up and you're going to set your alarm and check your email one more time, and that unnatural light's on, and now you're wide awake again because you're not allowing yourself to release melatonin. So that's not a good sleep habit. So if you take melatonin for sleep, get the melatonin at Mako's. It's a micronized melatonin. It's a much higher quality than what you get at Walmart or Sam's Club. And start with a low dose and keep going up until it works. When I first started at 1 milligram, slept like a baby and wanted to sleep the next morning, so it's too much. Now I'm on 5 milligrams. Dr. Rouzier, who teaches this, he's on 50 milligrams a day. So everybody's at a different tolerance. You don't want to wake up drowsy in the morning, and you don't want to have nightmares or vivid dreams, which some people have. So those would be reasons to not take it. But I would definitely try this. This is the natural sleep aid. This is what your brain makes to help you sleep. You already have a built-in sleep hormone in your brain. So I just want to show you how supplements, I talked to you before about exercise supplements and plant foods, how it fixed my chemistry, my blood tests, and then I started taking hormones because I was trying to burn off this belly fat. And it wasn't working very well. So then I had a motivating picture taken of me maybe 15 years ago. My family was at the Schönbrunn Inn, and my parents came, and we were all swimming in the swimming pool, 3 o'clock in the afternoon. I don't like cold water, but I got in this cold water because my kids were there, everybody was there, and I was wide awake by 3 o'clock. 10 minutes later, I'm sitting in a chair, and somebody snaps this picture. I'm like fast asleep. And I thought, nobody's ever going to see that picture. And here I am showing you the picture. So what's impressive about this are the man boobs, the little 6-month pregnancy, and the shoulders that have no muscles in them. And I was, probably 47, 48. And that was about the time I found that my hormone levels were not optimal. So do you think I am humble enough to show you this story and end with this? I wouldn't do it. I almost hesitated to show you this other one, but I'm trying to make a point. When you eat right and you exercise, it can definitely change your look. So that was a selfie. That looks better here than up there. Yeah. Well, and then this was something I couldn't do a wide grip pull-up when I was 35, but I can do 4 or 5 of those now with the hormones and with good exercise. So Dr. Rouzier, this is the doctor that trained me, and this is an excellent book. If you want to know more about hormones and the science behind it and the research that promotes it, this is an excellent resource for you. There's some other books that you can get by other authors that I've heard speak, and these are all good books too. They're proponents for the benefits of hormones that we talked about, but nobody talks about hormones like Dr. Rouzier. I mean, he is definitely the expert. He taught all of these authors. So these are your assignments. We've already talked about your assignments, right? I don't think we don't have a holiday coming up. We kind of missed. Oh, we have Easter. Yeah. We have Easter, so just pretend like you want to develop a meal plan for Easter. And all that means is decide now how many pieces of that chocolate bunny you're going to have. because it's not going to be the whole thing. Or, maybe instead of a big piece of ham, it's going to be a smaller piece. Just make all those plans now so you don't get out of hand when it's time to eat all those foods that are sitting before you. Okay, and then I want you to keep doing your exercises, your stretching, and keeping your heart rate up. All right, so next week we will talk about, it'll be a review of what we talked about the last 11 weeks. And next week you're going to see how this all comes together and you're going to realize how much you've learned. But I'll tell you, and I know Debbie and Kelly, we're like, you guys are phenomenal. I mean, you guys really have learned a lot. Deb, did you want to say something?
Yeah, I just want, first of all, I want to say, Dr. McKnight's an expert in hormones. I've been on hormones for probably, I don't know, it's been 3 years. It took me a while to convince Seth to get his hormone level checked. I just think with guys, it's I don't know, like pride thing, but kind of like Dr. McKnight's picture there. Seth would fall asleep in the chair. He was moody and grouchy, and he's not here to talk about it. He finally went and had his levels checked. He is on testosterone. What a difference. I mean, it's pretty bad when your son notices, man, because our son's a vet, so I mean, I told him about this, whatever. I said, your dad is just, I'm worried about. He is so different. Jonathan, our son, has noticed the difference in him. I mean, his stamina. And it's not just about libido and sex. There's so much else involved in this. It's such an important piece of that puzzle that if they're not optimized, they feel like crap. So it's made a difference for us. That's,
Thank you.
He's not here, so. We're all adults, so, it just it is what it is.
Yes.
Well, I'm going to vouch for Dr. Jakubowski. I have gone to him.
Are his hormone levels good? Okay.
I have had back injections and different things. I have a lot of back problems. In, 6 visits to him, he's got me feeling really good.
Mm-hmm.
He has done a marvelous job.
Have you ever been to a chiropractor before?
A long time ago, when I was pregnant.
Yeah. It's just his approach is, I think it's so unique. I've got a friend who's a chiropractor that just sort of doesn't really touch you. He just puts devices on, and I guess that works for some people, but Dr. J really gets the joints moving and he stretches the muscle, and you usually feel a lot better when you leave.
It made me feel better than
Yeah.
any of the injections or.
Yeah. Thank you. He's excellent. Does anybody else have any questions?
Well, I have something else to add. About the turmeric, like I have to do a lot of talking and convincing. So he kept complaining about his knees, and I said, I really need to try this turmeric. It really makes a difference for me. Because I was out of it for a couple days, and I get the New Year's prescription. I don't buy the cheap stuff. And it's worth the investment. Because I was out of it, and I'm noticing, man, my knees are really hurting me. They haven't been bothering me. So he started the turmeric, and he's like, man, you were right about that.
Excellent.
It works.
Yeah.
It really, it pays to invest in a good product.
Yeah.
Okay,
Thank you.
I'll talk.
No, that's great. Yes.
Will my attending physician test me for hormone levels?
Probably, if you ask him, they probably would, but they probably wouldn't know what to do with. They'd probably say, "Oh, you're in the range for a menopausal woman." And you're like, "Yeah, I knew that."
What do I do? Do I come to you, Doctor?
Yes, if you want to see me for hormones, I can help you with hormones. Yeah.
My question is, a lot of these screening tests, they end at age 80. You're over 80, you're home free then? or what?
Yeah, pretty much. Yeah, it's like everything's a bonus. Everything's normal after 80, right? Yeah.
What's the difference between Provera and Depo-Provera?
There's a slight chemical difference between the two, I think. But Provera they're both synthetic progesterone, and Provera, Depo-Provera makes the body think you're pregnant, like you got high progesterone levels, so you don't ovulate anymore. Like you got to wait for the baby to be born. So it's why it's a nice, convenient birth control because it usually stops periods too. But they're pretty similar. But remember, Provera, and the studies talked about Provera, not Depo-Provera. So Provera is synthetic, and it increases your risk a little bit for those bad outcomes. But Provera and Premarin together, that's the really bad combination. That's Prempro. That should never be taken. You can take Premarin for hot flashes, but if you take too much Premarin, you might start bleeding. You might have some spotting or another period at 60, so you don't want too much of that. Any other questions? Yes?
I want to say one more thing. I said first week, I did this maybe 6 years ago, and it was good. It is so much better now. The information is wonderful. The classes are great. I wouldn't worry about the room not being full because, people are getting it online.
Mm-hmm.
And thank you so much.
No, you're welcome. You guys, this is the reason we do it, because you guys want the information and it helps you. And next week we hope to hear some of your stories. Whoever feels comfortable telling us what's changed in your life since you've gone through the class. So, but thanks. Yeah, we work really hard to, all of us work really hard to make sure it's helpful. Did you have a question?
Well, the progesterone you give for pregnant people that have low progesterone,
Yes.
is that a synthetic progesterone?
No, it would be a natural. I'm pretty sure. It's what I do. Yeah.
Okay.
As far as what I've seen from other OBGYNs, it's the natural. It's the safe one.
Okay.
Yeah. All right. We'll see you next week. Thank you.